Good morning, and thank you for inviting me to speak this morning to you about sleep in the workplace. My name is Nargis Weir, and I work at Inova, but also at the NIH, at the Advanced Lung Disease Program. I am trained in sleep, and I am actually very passionate about this topic. Hopefully, by the time I'm done speaking, you'll be passionate about the topic as well. I believe that we spend a third of our lives sleeping. Hopefully, we spend a third of our lives sleeping. But that time is very important, and it impacts the two-thirds of our lives that are awake. And hopefully, in the next 15 to 20 minutes, I'll convince you that it is very important. So, as we go through the slides, you've all probably heard of the Exxon Valdez, and you've all probably, to some extent, believed that the Exxon Valdez accident happened because the captain was drinking. What you probably don't know is that the Exxon crew was working 12 to 14-hour shifts and overtime. So this was a crew that was half the size of the crew that was normally used on these excavations, and they had already gone, they'd taken the oil, and they were returning, and they were working very long hour shifts with very little break. So on the night that this collision happened, yes, he had been drinking, but he was profoundly sleep deprived. And that is very important to note because, as you recall, this oil spill was massive, and we're probably going to deal with the ramifications of it for decades to come. You all know Tracy Morgan, I'm sure, comedian, actor, very famous, and you all probably remember this from a few years ago when he was in this massive collision and his limo was hit by a Walmart truck. I think you do remember that the Walmart truck driver was sleep deprived. Well, the story behind that was that the Walmart truck driver left his home in Atlanta and drove up to Delaware. That was 12 hours of driving, and then began his driving shift of 14 hours. So 26 hours of driving without sleep. It's no surprise that this collision happened, and this was in New Jersey. Obviously, sleep is very important to many occupational settings. And we just touched on truck drivers, but it's very important in airlines. You don't want to get on an airplane where the pilot has not slept. Trains, there are numerous accounts of accidents, train derailments because of sleep deprivation. Any mass transit worker, obviously, this is important. There have been accidents and near misses with nuclear power plant workers. Now there's evidence and there's even legislation with physicians in training. If physicians are awake beyond 24 hours, that their cognitive ability declines and their errors go up. So there's actual legislation for that. And I will go beyond that and say that in any shift worker, that this is a serious problem. And I'll hopefully convince you of that by the end of this talk. So what changes have been made? Well, in New Jersey, ironically, where Tracy Morgan's accident happened, there's actually laws about this. It's called Maggie's Law. And if you're caught with drowsy driving, you can go to jail. So definitely, I mean, it's interesting because we talk about drunken driving, but there's drowsy driving is just as dangerous, and I'll show you some of that later. In all states, pretty much, if you're a truck driver looking for a job, you need to be screened for sleep apnea, and you need to show that you're compliant with your CPAP. I kind of hinted at this earlier, but the ACGME, which is the body that overlooks training for medical and surgical residents and interns, limits the hours that they're allowed to work in a row now. And this wasn't true when we were in training, but it's certainly true now, and it's still an ongoing effort because really the data is very strong that errors go up beyond 24 hours. So it's not so much about protecting the physicians, it's about protecting the patients. And then airline pilots, I hinted at this earlier, they're required to sleep 10 hours before they fly, and they can't fly more than 8 to 9 hours. And so this is really, again, not about the pilots, it's about protecting the customer, about us. So it's very important, and I think it's kind of eye-opening. It does protect the pilots, it does protect the residents and the interns, but more importantly, we are in a service industry, and these have social ramifications. So with all of that said, hopefully I've got you bought in that this is important from a social perspective. What does normal sleep look like? You know, we all talk about sleep, we all do it, we think we understand it, but what does it look like? So what is sleep? Sleep is a time of rest for the body and for the brain. So physiologically, the body has slower metabolism when we actually sleep. Every organ slows its performance. The heart rate slows down. The kidneys have slower filtration. The lungs slow down their respiratory rate, and they decrease their tidal volume. The brain, interestingly, doesn't slow its metabolism, but it has very distinct stages in sleep, and you can see that when you do a sleep study. You see different stages of sleep. What's very interesting is in the last 5 or so years we've learned some new science that the brain actually restores itself in sleep. And I didn't put this up here, but it actually cleans itself out. There's called the glia, or the glymphatic system. And it actually cleans itself out when you sleep. So when you sleep, it actually kind of gets rid of some of the debris, resets itself, kind of like when you take your phone and you turn it on and off and it kind of resets. That's what the brain is doing when it sleeps. So some other important sleep facts. We all need sleep. One of the most frequent questions I get asked as a sleep doctor is, Doc, how do I get by with less sleep? And the answer is you can't. All mammals need sleep. Even insects demonstrate a need for sleep. It's not called sleep in insects, but they still demonstrate a need for it. When you don't have sleep, you have physiological and psychological deterioration. What do you mean, Doc? Well, when you look at depressed patients or psychotic patients, right before they have their depressed episode or their psychotic episode, they have a dramatic change in their sleep, either increased sleep or decreased sleep. But sleep has to be stable and normal for us to have physiological stability and psychological stability. Another case in point is a very rare disease called fatal familial insomnia. It's exactly as the name says. It's genetic. It runs in families. It's profound insomnia. These people can't sleep more than 3 to 4 hours. And it leads to death. By their 20s and 30s, these people die. And so it just goes to show we absolutely need to sleep. Sleep changes with age. Anybody who's had children or been around children will tell you newborns, 0 to 3 months, they need to sleep a lot, 14 to 18 hours. And in that first year of life, they're still sleeping a lot, 12 to 16 hours. This is data that was taken from the National Sleep Foundation to come up with what are the normal ranges of sleep across a lifespan. And what's interesting is that by school age, children actually need 8 to 12 hours, which they're not getting in this country anymore. Teenagers need 7 to 11 hours. And our teenagers are really not getting that in this country anymore. And I'm just going to go off on a little tangent here. There's been a lot of legislation trying to push school times back a little bit and trying to get teenagers to start school later in the morning. And people have said, well, we used to get up earlier and it was fine. But what we're really finding is that these kids are actually going to bed later and later for whatever reason, whether it's schoolwork or they're staying up late because of devices. But the truth is that they've actually looked demographically at different counties where they have pushed school start times later, and they found that motor vehicle collisions go down when these students are able to get even as little as 1 hour more sleep, just over 1 year. So getting enough sleep has societal and personal implications. What about adults? Well, we need 6 to 10 hours of sleep. And I have people who come up to me, it still happens, they say, well, I've always slept 4 hours and that's all I need. That's just not true. That's just not true. I told you, I mean, we're human and we need a certain amount of sleep. Now, we used to say that we need 7 to 9 hours of sleep, and with this last NSF expert consensus, they really did expand that to 6 to 10 hours. So we've gotten a little more flexible in our recommendations, but the truth is that you cannot get by with less than 6 hours of sleep. You absolutely cannot. And I'll show you the data in a little bit. And then as we age, our sleep needs actually do decrease at 6 to 9 hours. Sleep serves a purpose. We just talked about sleep having a very important need. When you restrict sleep, when you don't sleep enough, you get tired. That seems very self-explanatory, but you also get sleepy. You have the desire to sleep more. You have trouble concentrating, and you've all probably felt that, and you can't deny that. One of the interesting things is about 15 years ago, we discovered that there were hormonal imbalances. So the hormones I'm talking about are leptin and ghrelin, and those are the hormones that have to do with hunger and satiety. So if any of you have actually stayed up all night for whatever reason, a call shift, an all-nighter, whatever reason, or even just with a crying baby, you will know that the next morning you notice that you are hungrier than usual, but anything you eat just doesn't satisfy you. In fact, you're craving carbohydrate-rich foods or really salty foods or really sweet foods. And that's what we mean by the leptin-ghrelin imbalance. And what's interesting is that those things actually lead to the progressive weight gain that we notice also in patients who have sleep restriction. There's also hypertension or high blood pressure and other cardiovascular diseases that we see in sleep restriction, along with depression, and we don't quite understand that. There's a lower threshold for subjective pain. They've studied patients with rheumatoid arthritis and also fibromyalgia, and they found that those who have less sleep compared with those who have more normal sleep have more pain for the same amount of arthritic pain or just pain scores. So sleep definitely alters your subjective pain. They have poor psychosocial functioning. They have trouble fitting in at work. They have more trouble at home. They just have trouble with their functioning. And the most troublesome studies, and we really just have seen this in all cohorts from all countries, and these have really been borne out mostly from the insomnia studies, is that all-cause mortality goes up with sleep restriction. This has been shown in study after study after study. All-cause mortality goes up with sleep restriction. So let me just define some of these terms that I'm starting to throw around. Sleep restriction means that you're not getting enough sleep. You're deprived of sleep. Probably another synonym would be sleep deprivation. Sleep fragmentation means that your sleep is broken up at night. It means that you're getting up multiple times in the middle of the night and you may or may not remember it. Now that can be caused either because you have sleep apnea, or because you have a dog that's sleeping on the bed next to you, or because you have a baby that's waking you up, or because your pager is going off, whatever. Your sleep is broken up. Fatigue means you're tired. You have tiredness during the day. Sleepy means you feel like you need more sleep. You feel a sleep urge, a pressure to sleep more. And so fatigue and sleepy are not the same. So this was a study that was published last year in Circulation. This is a very pivotal study in my mind because they looked at insufficient sleep, everything that fits under the umbrella of not having enough sleep. And they found that if you got 6 or less hours of sleep a night, that it was linked to all the adverse outcomes that are cardiovascular. And this to me is kind of a new aha moment and a new way of thinking. We really haven't been thinking this way. Yes, we talk about snoring and sleep apnea. Yes, we talk about, having to lose weight if we have sleep apnea, but nobody's really talking about insufficient sleep. like this paper suggests we should. I'm now going to switch gears and talk about acute sleep deprivation versus chronic sleep deprivation. Acute sleep deprivation is when we don't get enough sleep for really a couple weeks or less than a month. So in the short term, and I'm going to talk about a few studies to sort of hit a few points. So this was a study in 2003, published in the journal Sleep. This was a study of 48 subjects that were randomly assigned to either get no sleep at all for 3 consecutive nights, or to get only 4 hours of sleep every night for 2 weeks, or 6 hours of sleep every night for 2 weeks, or 8 hours of sleep every night for 2 weeks. And they found that if you got 6 or less hours of sleep, so anybody who got 6 or less hours of sleep had the same cognitive performance, okay, so their brain functioning, the same deficits as if they had 2 nights without any sleep. So, I just think about all the times where we go 2 weeks in a row of just sleeping 6 hours a night, where, we're just kind of burning the candles at both ends and we think we're doing okay. But think about those times when we're not sleeping for 2 nights in a row and how awful we feel. You're having the same cognitive performance. Would you actually do surgery if you hadn't slept 2 nights in a row? No. But why would we treat patients? Let me go on to the next. They also found that if you were awake for more than 16 hours, that you had performance lapses. That's not a lot. I mean, in 24 hours, if you're awake more than 16 hours, that means that you've slept only 7 hours. That's not a lot. They also found that the subjects really were unaware of their cognitive deficits. So the subjects that were having trouble didn't know it. This is another study by Banks in 2010, and they tried to figure out how much deficit do they need. Well, they found it was a little individualized. Some people had deficit after 6 hours, some people had deficit after 7 hours of sleep restriction. But what they found overall was that when you had sleep restriction, the first thing to go were the monotonous tasks. They had cognitive impairment, which means that they had trouble thinking. And the first things to go when you had trouble thinking were the tasks that you're used to doing over and over again. So in your situation, it would be daily unit checks or inventory. Driving is a monotonous task. When you drive to the same place over and over again, you have cognitive impairment when you drive to work and you haven't slept well. But think about the job that we perform on patients, and a lot of that is monotonous as well. The other thing they did as part of the study that was very important is that they took people and they sleep deprived them, and then they let them catch up on their sleep. So they sleep deprived them for, let's say, 4 hours, but then they let them catch up for 11 hours, and then they studied them in the sleep lab. And what they found was they restored their sleep beautifully. They got into deep sleep, and they got into REM sleep, so they had physiological recovery of their sleep. But then they did neurocognitive testing on them, and they found that their neurocognitive recovery took much longer. So the take-home message here was your physiological recovery may be there, but your brain's recovery, your cognitive recovery takes longer, and we don't know how long that takes, and that's an individual recovery. And there's actually an entire group up at University of Pennsylvania that is looking at this, and they said that there's really no way to tell. With each person, it's different. So here's another study in 2001 where they found that if you had acute or short-term sleep deprivation, it led to depression in some or anxiety in others. And it led to sleepiness, which makes sense. But it also leads to something called microsleeps, which means that you think you're awake, but your brain is going in and out of light sleep. And you can only tell that if they're actually hooked up to electrodes so that we can read the EEG. So this is where you're driving in a car and you think you're awake and you're doing a very monotonous task, right? But your brain goes for 2 to 3 seconds, maybe even 5 seconds into sleep. And that's just as long as it takes to crash into the median or into the car next to you. And that's exactly what happens when these driving accidents happen, when these workplace errors happen. They're called microsleeps. And then the final point of this study was that you have enough of these acute sleep deprivations, and they start to change your circadian rhythm, which is actually your natural clock. And so if you have these acute sleep deprivation episodes, you actually are really messing around with your circadian clock. So what about chronic sleep insufficiency? These are people who get 5 or 6 hours of sleep Monday through Friday, and then they try to catch up on the weekends, but they're only getting 7 or 8 hours. That's chronic sleep insufficiency. That's long-term sleep loss. I've already told you that they have cardiovascular outcomes, that they have workplace accidents, and this all leads to societal burdens. What you need to know is that more than half of all fatal truck accidents in the U.S. are partly due to excessive sleepiness. So if we were to make society aware of this, we could get rid of half of the truck accidents. There was a very interesting study that was published in 2011 in JAMA that was actually done in 2003. It was done in police officers, and they actually sought to look at their sleep habits, and they found that sleep deprivation, just sleep deprivation alone, contributed to the anger, to misuse of force, and to errors. Now, they admitted that a small portion did have sleep apnea and other sleep disorders, but sleep deprivation was what was contributing to the anger, the misuse of force, and to errors. And what was happening is that the police officers were actually not able to continue working. They were being taken off the force. They were being forced to have sick leave. So it was a really very unsettling contributor. So chronic sleep insufficiency or long-term sleep loss leads to sleepiness. But what else? You have less productivity. I mean, your brain is not functioning. You're not having the cognitive productivity you need. So you're just not able to produce what you're supposed to do at work. You have an increased need to nap. It's one of the questions we ask when we do a sleep history, by the way. Do you nap? You shouldn't be sleepy, and you shouldn't feel the need to nap. One of the other questions we ask on sleep histories is, how much caffeine do you take in? There's a reduced participation in activities of enjoyment. Why do we say that? Because you have less desire to have psychosocial functioning. There's depression and anxiety that goes with this. There's an embarrassment because you just feel like I'm not being the best that I can be. This creates friction at home and at work, and eventually leads to marital discord. These positions that have chronic sleep insufficiency have a higher rate of divorce. And obviously, I can say, being a doctor, doctors have one of the highest rates of divorce. Immunosuppression is a very interesting point. In the last 2 decades, we know that chronic sleep loss is strongly associated with lower immunity and a higher rate of viral illnesses, and not so much cancers yet. We haven't borne that out, although sleep apnea is associated with higher risk of cancers, but immunosuppression, absolutely. Obesity, we talked about the leptin-ghrelin imbalance, obesity, and then prediabetes, and even a frank type 2 diabetes mellitus has also been shown with chronic sleep insufficiency. So at this point, you're asking me, Doc, what can I do? I mean, you're either saying, I don't want to end up like this, or you're saying, I recognize some or even all of these things in myself. What can I possibly do? Well, awareness. If you don't recognize sleep as a limitation, you can't begin to take the first step. And I think that's half the battle. I mean, until I started to study this and become trained as a sleep physician, I didn't even recognize this as a problem. Responsibility. We need to own up and take our own part individually so that we can make a difference in our own lives first. And then choices, because once we become aware and once we take ownership of this, then we can start to make choices. And every day we're faced with choices. The foods we eat, the caffeine we ingest, the exercise we choose to participate in or not participate in, the timing of that, how much screen time we have, all of these things are choices. We make them. How late we choose to stay up doing whatever activities we choose to do, all of these things, the jobs we choose to work, and the decisions we make about our lives. Sleep hygiene is part of all of this. There is not a single patient that comes to my office, whether they have sleep disorder breathing or not, that I do not engage in sleep hygiene counseling. To the point where I actually made a sleep hygiene handout, and I've actually shared it with your medical director. Whether you have sleep issues or not, you should review sleep hygiene and incorporate it both at home and on your shifts. There are very important topics on the sleep hygiene handout that I do believe will make your 8 hours or 9 hours of sleep more restful. There are environmental issues, there are exercise-related issues, and then there are issues related to that occasional insomnia that you may or may not have. And we all will have them from time to time, especially when you have disrupted sleep. And then the final thing is on an organizational level, you need to advocate for better shift structure. If you are like the rest of the world, I mean, what has happened, and I didn't show you these slides, but we are all, as a society, in the last 15 years, driving farther to better paying jobs, which means we're spending more time on the road. We are therefore sleeping less, but it's just creating a more chaotic life with less sleep and more stress. So how can we advocate for better shift structure so that we can have a more sustainable workforce and not only service our customers better, but have healthier workers? So with all that said, I really do believe that we should practice what we preach. When I started on this venture about 15 years ago, I was not doing any of this. In fact, I thought sleep was just sleep apnea. And now I realize you can't just treat sleep apnea. If you have the symptoms of sleep apnea, we didn't even touch on that today, you absolutely need to have it treated. But you can't just put CPAP on someone and think that it's over. All of the things that I talked about are actually just as deadly as sleep apnea. With all that said, I'm going to stop now, and thank you for listening.